Hi friends, now today I have the honor of introducing to you Dr. Ekamjyot Singh Gulati. He's passed his MCI screening exam this time with us with a score of 182, which is a very good score considering the level of difficulty of the exam. So Ekam, how are you feeling today?
I feel good. I feel good. I feel my parents feel a lot more relaxed than I personally do. Yeah.
Yeah, is it a feeling of relief at home?
Definitely. Yeah.
And how did you manage things like when you were preparing for the exam? And there is so much negativity around the exam. People keep telling that the passing rate is not good, and parents must be worried. Then how did you manage the entire scenario?
To be honest, I think what worked with me was the fact that I didn't know a lot about the exam before starting my preparation in July and August. So one of the first classes we had was physiology, and Reena ma'am said something that I really sort of stuck myself to. She said, "You got to believe in what the teachers tell you, and not the word on the streets is what the rumor is, because I feel there's a lot of hype around the exam. Do this, leave this subject, do the short subjects, do the long subjects." But she said, just believe in us. Just try to do what we tell you to do, focus on your basics, and the result's going to be in your favor.
And how was your experience with the regular course that you joined in the classroom course? Like, what did you do in each class? How did you, learn in the class?
I feel like for a second, if we just forget about the exam, just as a budding doctor, I feel more confident in my knowledge and my skills now. They told us a lot about patient scenarios in India, which kind of gives us an idea of how the hospital system works here. So I got a lot of confidence in sort of believing that, I know stuff, I know my basics are good. So they really helped us with that. And the regular course was really intensive. I think one of the reasons that I was able to clear the exam was the fact that we had these 12-hour long lessons, and I would just try to do and just revise that one bit. It was overwhelming at times, but I feel in the end it just worked out.
Yeah, and often sometimes it is overwhelming, I know, but we try our best to cover the entire thing.
Yes,
and
yeah.
So that because we know the value of each mark in
Definitely,
this exam,
definitely.
so we try our best to cover the most possible.
Most definitely. I feel if teachers wanted, they can just rush through the syllabus, because the teachers teaching the particular subject are actually experts of that particular subject, and they're totally fine with answering doubts no matter how long that takes. So they kind of arranged the course in such a manner that in those 3-4 days we were able to complete the entire syllabus that was necessary for exam. And not just that, after a day or two we would have our test and discussion, which really helps us understand concepts on another level.
And when you mention teachers, any particular teachers that you remember today that helped you in this journey?
I feel like I'm not gonna do justice by naming just a couple of teachers, because I really enjoyed the way teachers teach at DAMS. I'm not saying this to sort of like flatter the faculty at DAMS, but I personally really had a good time at DAMS. For psychiatry, I had an amazing time because I personally am really interested in psychiatry. He shared some amazing cases, and going to class was not a class. For those 2-3 days we forgot that we had MCI exam. It was just like a seminar in psychiatry. We would laugh, he would tell us these interesting cases. For gynecology, he would make it so simple for us. And gynecology is that one thing that as male doctors we kind of ignore during the 5 years, because it's like, oh, we don't want to do gynecology, but he really made us understand the basics, and we felt comfortable in it. For surgery, Dr. Gaurav Patel went through so many topics. He took his time, and we were like, oh my God, the notes just keep piling on. It's like a novel. It's like a guidebook. But now when I look at my notes, it's actually like a book. Like I can go back and study and just understand concepts. So the teachers were really helpful. It made a big difference.
And did you also utilize the testing that we do, like the tests that happen after the class and the CBT that we conducted?
Yeah, I think one thing I made sure was not to miss any of the tests. I sort of had to gather some courage, because you kind of feel not confident enough to give a test. You feel like, oh, I'm not ready, or I'll study in the last days. But I was like, I just want to go to the test and get as much number of questions I can get wrong possibly, just so that I know those concepts for sure. So I attended all the tests. I attended both the CBTs, and I'm not gonna lie, the CBTs were pretty difficult. Like it was kind of demotivating, because 5 to 10 days before the exam. But then I was like, no, this is helping me to even sort of like freshen up my skills or just improve a little bit in certain
Plus,
weak
you get
areas.
used to the idea. Our idea is always to make a mock test a shade tougher than the real exam. But you
Yeah.
would appreciate that, even this time the exam itself was also tough.
It was, and
Yeah.
I mean, the first one was, I would say, pretty on the spot. It was like decent questions, but the second one was, it wasn't difficult. Let's just put it this way: it was really concept based and really clinical. So you could not say for sure what's the answer. It was not like a one-liner sort of
Yeah.
base sort of question paper. You really had to think. If you knew your basics, your concepts, you would get the answer right. But at the end of the second half, you didn't know how many answers were right or wrong. You know what I mean? So it was all concept based.
And what else would you recommend to people who are appearing for the exam next year? Like, you have given this exam this time and you had no idea what the paper would be like.
Yeah.
But now you have given the exam. Can you analyze the paper for future aspirants? Like, how did that exam feel like? What were the topics they were stressing on? Like, can you give an overview to the people who are listening to you?
Honestly, I feel like you can never know what they're gonna ask. That's just what I've learned. I feel one of the good things was that I didn't know anything about the exams. I would say just listen to your teachers. They've been doing it for a while. They're experts in their particular subjects. Trust the process. Just do what they're trying to tell you to do, and just keep working hard. Try to like cover the stuff a little bit, a few pages every day. Just keep going at it. Feel confident about yourself. There's gonna be days when you feel down and you feel like you won't be able to do it, but just trust the process and keep working. In the end, I'm sure if I can do it, I feel most people can do it, because I never thought I could do it myself.
And I'd like to add here is that it's very important to understand that the passing this exam is primarily based on making basics. You have to make concepts on all your subjects, and you have to learn the basic of each subject. You have to have working understanding of each subject. It's a very big myth that do short subjects or leave short subject. I agree. The many people will
Yeah.
keep advising,
Yeah, I agree
their
100%.
own, fantasy strategies to you that, okay, forget about this, do this. In the end, what happens is you need to have basic command of each subject. Even if it's a short subject like psychiatry,
Yeah.
you will get 4 or 5 more answers correct in the
Yeah.
exam, and that will make you safer.
Yeah.
And you have to be safe when you're giving this exam. You don't want to get out at 140, 145. You have to
Yeah.
pass this exam.
Yeah, that's heartbreaking. Yeah,
Even in radiology, like it's a short subject, but it will give you good 6, 7.
definitely.
Simple things
Every
to
single
answer.
mark counts.
Yes.
Every single question counts.
Yeah.
And as sir said, I would say the same thing. Just because I've passed the exam, I'm not going to say you guys should listen to me. I feel you should just try to get your basics right. Just study the concepts. Listen to what the teachers are saying. Trust me, a lot of the stuff they say are actually going to show up in the exam, and you're going to recall it and understand, oh, I know that question, because that's what happened with me. At least 30% of the questions were straight what the teachers told us was important and what was not. So just trust the teachers. Just do what they say.
And any particular advice for like when you were graduating in China, like how did you manage those MBBS years? Like it's a very important thing that many of the listeners today may not be graduate now. They might be in the process of it, maybe in second year, third year. Any particular advice you want to give them at this time?
I feel like there's just a lot of negativity attached in our society about students wanting to study MBBS abroad. We're considered sort of the inferior batch of students who want to go abroad because we didn't get a seat in India. For me personally, that wasn't true. I always wanted to go abroad and study medicine. I'm glad that I got the chance to study medicine in one of the best universities in China. We got to learn state-of-the-art facility and how the system works there. I feel like you should actually start sort of preparing for the MCI exam from the first year itself. From my own experience, I didn't do that, and that was my bad. It was my mistake. But I think the only thing that helped me in the end to pass the exam was that I just focused on my basics. I just read the international books that hold true here as well. So I would just say, just keep focusing on the basics. And if you can pass MBBS degree there and work hard here, you will definitely be able to pass the exam.
Plus now we have, for people who are studying abroad, now we have some opportunities, like we have a vacation course in Delhi where when you are coming back on a vacation, you can
Definitely.
utilize the classes and
Definitely.
get an idea about the subjects and how much you need to study. Another thing I feel that you can do is, now on eMedicos we have online course where you can subscribe to anatomy module while anatomy is going on in your medical school. You can do it parallel on the app also.
Yeah.
So I feel these are the things which will, help you stay connected to the cause.
Definitely.
But when you come back, you do a full regular program, listen to teachers fully,
Definitely.
and try to do it in the one go. Don't try to be so negative about it that, okay, I will do it in twice go, and like
Exactly.
you'll end up killing up your own opportunities.
Without a doubt. Studying for this exam for another 4 months or 5 months would not be fun at all. I'm so glad that I'm done. And when you're done, you will feel so much better and confident about pursuing future exams, courses, whatever. Because now we feel we're on the same level as any of the medical students or junior doctors in India, you know. And thanks to DAMS that we're now ready to sort of like start our career here in India. It wouldn't have been possible.
What are you now planning to do now?
Now I'm just like sort of relieved, but I'm planning to work for a bit just to get some clinical experience and then just start preparing for exams. Yeah.
And you told me that you wanted to become a psychiatrist.
Maybe, yeah. I like psychiatry and cardiology. Cardiology has a history in my family, so yeah.
Let's hope for the best.
Yeah,
I'm sure
thank you so
will
much,
do well.
sir. Thank you.
Now the time to have final 2 messages from you. Like one, an academic message for future aspirants. Like how do you want them to, shape themselves up for the MCA screening? And second is the motivation thing. How do you maintain your motivation in a phase of negativity? Like you know it better than I do that when you are abroad, sometimes the negativity hits you.
Yeah.
And secondly, when you are preparing for MCA screening, sometimes it hits you. You meet people who say, "I have not passed 5 times. How can you pass?" Like that.
Yeah.
So how do you manage that negativity?
Yeah.
And how should you do the academic thing as well?
I know this is going to sound really weird, but I think one thing that worked in my favor was there wasn't a lot of Indians in the 4 or 5 years I was there in my university. So there was no talk of the MCI exam. So I was kind of, I was away from all the rumors, all the news of MCI. That kind of helped, which is not good, but it helped me, I feel. I was just busy enjoying my 5 to 6 years in China, just focusing on my studies, giving exams, passing semesters, and also taking life easy because at the end of the day, we're young kids, we want to have fun. We want to explore the world. And I feel going abroad, people forget that going abroad, it changes it. It makes us a better person. We know the world a little better. And while I was studying for the exam, I knew what China had given me. It had given me a degree. It had given me education, life experiences that I wouldn't have had here. And while I was studying for the exam, having great mentors, teachers who were just not teachers. You could just text them and ask them for advice. And there are going to be days when you feel down. There are going to be days when you feel you cannot do it. But in those moments, you got to stick close to your loved ones, your friends, your family. Like my mom was my support. I would call her. She would help me when I was down. And she would always sort of give me some confidence and say, look, you can do this. Even in those moments when I was like, oh, my mom doesn't know what she's talking about because I'm going to fail this exam. But, deep down it helps because there's somebody you can count on. Exactly.
Who has trust on you,
they
has faith on you.
Definitely. They have my back. Even my girlfriend, she played a big role. She was always there to help me out.
So with this note, Ekam, I would like to wish you the best in your future endeavors.
Thank you so much.
And I would again like to congratulate you on your outstanding success. 182 is a very good score.
Thank you so much, sir.
And I would also like to congratulate your parents, your family,
thank you,
everybody associated that they feel probably they also go through a lot of stress.
Definitely,
and I'm sure it's a moment of relief for them.
I feel like all MCI aspirants can relate to this. All my parents heard in the 5 years I was in China was like, oh, the MCI exam is so difficult. How's your son going to do it? So now that it's done, they're relieved. Unki jaan mein jaan hai,
Heartiest congratulations, and I'm sure today unki jaan mein jaan hai, aur jab aap aur aage badhenge, they will feel even more proud.
Yeah, thank you so much, sir.
Heartiest congratulations.
Thank you so much, sir.
Congratulations.